you're so welcome along to the launch of my Expert Midwife. I'm Suzanne Kane, I'm your MC, I'm a broadcaster, a voiceover artist, I work for Ireland AM, and I'm a mum of 3 kiddos. So I have a 6-year-old Oisín, a 4-year-old Hannah, and 16 weeks ago we welcomed Sadie into the world. And I am so excited to share a product that I was introduced to 16 weeks ago that I wish I had met 6 years ago, my Expert Midwife. We have a gorgeous panel of incredible women to talk you through the products, but more importantly, to talk you through this journey that maybe you're embarking on for the first time, or like me, you've done it for the 3rd time and you're still going to Google. But the good news is my Expert Midwife is here. It's a reliable source, and it's not just about products. It's about so much more than that. It's about a community of women that are there to support and to nurture, especially when we need them right now, as we face into uncharted waters with pandemics and pregnancy, maternity care, postpartum, and everything else in between. So sit back, relax, enjoy the conversation. You are so welcome, and we're delighted to have you along. So let me talk you through who is here today. She is the main woman, quite literally. Lesley Gilchrist decided years ago, working on a labour ward, that things just weren't right. It wasn't good enough. She was telling women who had just come from surgery, maybe an episiotomy, yeah, we're going to talk about those today, that water was what they needed. And she knew that women deserved so much more. And there she decided she was going to do something different. And after years of developing and figuring it all out, that she'll explain to us all now in just a couple of moments, my Expert Midwife was quite literally a labour of love and was born. So she will be joining us today. And we're going to talk to a midwife, because we need all the midwives, because they are there to support us. And Jess Sheridan is definitely that lady. She's a mum of Ellie, who's 4, and of course is taking her expertise to the labour wards of Ireland every single day. And we're delighted to have her expertise with us. Where else do we go when we're pregnant, or thinking about maybe conceiving, or in those weeks and months after we have our babies? To our local pharmacy. And pharmacists play such an important role, especially right now within our local community. So it's really important that we go in and chat with them and have those conversations that maybe sometimes we don't want to say to our friends or to our other half, but you're very safe in that world. And that's where Emily comes into play. She's a pharmacist with 20 years of experience. So we're delighted to have her along. And then one of my favourite people to sit and watch on Instagram is definitely Shoshannah Wood. She's a mum of 2 and is pregnant at the moment with Baba number 3 on the way. She has exciting days and slightly terrifying days ahead, but again is a wealth of knowledge. Yes, she goes under the influencer title, but she is way more than that. In terms of parenting, she never pushes her opinion on anybody. She very much lets her beautiful life and her children and now her pregnancy play out in front of us, giving us gorgeous glimpses of reality of being a parent, which is so important right now. So ladies, I'm so excited to chat about these beautiful products, and again the support network that my Expert Midwife brings to the table, especially right now. Lesley, I'm going to start with you, if you don't mind. Would you mind giving us a little bit more than I said there, expand on my Expert Midwife and how it all came about?
So as you said earlier, working on a labour ward and seeing women in the community after they've given birth and realising that they have this array of products for baby, many different brands, loads of products that, you almost question, do they really actually need any of those? Nothing for them, nothing that helped them navigate the pain and the recovery, helping to speed up how quickly you can get back to normal, helping with pain relief, thinking on the practicalities of, even the products that there are just not quite practical enough. So I'd already done, a qualification midwifery in the use of aromatherapy. So I knew that the products could be out there. I knew that there were amazing essential oils to help with, preventing infection and wound healing and pain relief. It's just that there was nothing actually manufactured so that you could safely, as a midwife, feel safe in saying, right, if you do X, Y, and Z and use it this way, that will help. So I went to a manufacturer and sat down with them, lots and lots of backwards and forwards, trying to develop the product to make sure that we use the best ingredients, the most natural ingredients where possible.
and make sure that the delivery system that we used as well was really, really practical. So, you know, like our Spritz for Bits, it sprays upside down because the area that it's going to, the perineum, you can't get to it any other way, you know, unless you're sort of contorting yourself. It needs to be able to spray upside down. Women don't want to mess on with pouring stuff onto pads, and you don't want something that's wet at your perineum. You know, as much as that moist environment's good for healing, not a wet environment. So, you know, it's a really fine mist. The oils just sit on the skin doing what it needs to do without actually penetrating down any lower than it actually needs to. And that's, you know, we've got this worry, you know, when we're advising women to, you know, to bathe and keep wounds clean, that we're actually making sure that they're not having this wet, you know, this wet environment for wound healing. And it's really difficult when you see, you know, women being advised, well, soak your pad in this and soak your pad in that as midwives, we would be saying, no, actually, you know, you need something that's just going to deliver what needs to go there and then dries. And that's why, you know, Spritz for Bits is in the delivery system that it is in. As, you know, the rest of our products all have that same thought through philosophy, because, you know, women are, you know, they're becoming mothers, they're carrying these babies, giving birth to these babies, and there was just nothing for them. And even the information that was available to them was never collected in one place. So as midwives, we knew that there were websites and there were influencers that were very pragmatic and honest and spoke of, you know, the evidence behind why certain things would be done and wouldn't be done. But there's no way really for women themselves to discern that just by doing a Google search or just by going on Instagram. So I think as a brand, it was important that we only ever worked with people that we knew held that same philosophy. And as experts, we were always really clear that when we're talking about something that we're not experts in, so scanning, for example, or any of the medical side of things, that we make sure that we get those experts in to help, you know. And, you know, Emily, I'm sure you can testify that I think you only know, well, you know, you don't know what you don't know. And, you know, as you know, if you're trying to badge yourself as an expert, people assume that you do know absolutely what you're talking about. And that's something that we're really clear on at My Expert Midwife, is that we don't go outside of that lane. So we wouldn't start talking about drug interactions or any kind of products, you know, out with our sphere of expertise. But I think I've gone a lot now.
But you know what, this is the thing, and this is the wonderful thing about the space that My Expert Midwife is. Obviously, you have developed these beautiful products with women in mind, at the forefront at their most vulnerable time. But the actual space of My Expert Midwife, which is what we're kind of here today for, is that it is there to give you the safest interaction possible without claiming to be something that it's not. So it will give you the information that is available in terms of from a midwifery point of view, but you know, not somebody coming on to where we have across social media, people coming on claiming to be an expert in when they're not quite there. And especially, as we said, it is a really vulnerable time. So to kind of kick off the chat, I think maybe we should start, you know, almost at that very beginning of, you're coming maybe towards the end of pregnancy. And Jess, I might go to you first on this. And a lot of women talk a lot about a birth plan. And I suppose Lesley and Jess, you've both experienced this, I'm sure, on labour wards. There's a lot of pressure about going in with this laminate to your midwife or going to your consultants and saying, here's what I want. But what are your thoughts about birth plans for maybe a woman who's, you know, venturing into this for the first time or feels a pressure to have that? I'd love to know from a midwifery point of view what your thoughts are, Jess.
Yeah, I think they're a fantastic tool to have, and I think no woman should be under pressure to have a birth plan. I know from chatting to Shoshannah before, she felt a bit of pressure to come in with this laminate piece of paper, and some women like to go in with one. I personally didn't, and I know some friends that would be like, no, I need to go in, I need to have a plan, I need to be clear with everyone about what I want, and that's absolutely fantastic. And I think as a midwife and as a caregiver, it's fantastic to see kind of, you know, people's wishes, you know, laid out quite clearly, and then it kind of shows that, you know, they're very informed about what they want, and should it deviate from that you know, we advocate as much, obviously, for as we can to achieve that birth plan. But when things deviate, that we can see that this really isn't what they wanted, and that we just support them through, you know, throughout as much as we can if it should change. And I just think it shows kind of that I love coming in to see that women have done the research, they know what they want, and, you know, everything that they have on their birth plan. Should an alternative pop up, they can sometimes have, like, you know, if things change, I would like this as my alternative. But I just think it really offers guidance on both sides, you know, for you know, that kind of relationship as you approach your labour and delivery. So yeah, I'm very for them, but absolutely, when a woman comes in and doesn't have one, I just think, okay, well, we need to probably just take a bit more time to make sure that they definitely know all options. Whereas sometimes, you know, when a woman does come in with a birth plan, you can see that they have done the research, and that's really nice to see too. But I think, yeah, no woman should be under pressure to make one, and if you do have one, that's fantastic too. Whatever.
It works both ways. And again, I suppose this is the role that it's really important across the maternity hospitals, is that that's the role of your midwife. And your main role is to spend those whatever amount of hours with that woman and safely bring their baby into this world. That's your key goal in life, quite literally. Like, that's what you've signed up to. Shoshannah, you're obviously due baby number 3, and you've had 2 births previously. Have you gone down that road of a laminate? I had no birth plan on any of mine, but did you go down that road, or what would you, especially because you like me having a baby in a pandemic? So what are your thoughts?
Well, this time I have obviously a bit more knowledge as to what will happen, and I know the situation cannot be controlled. You know, anything can happen, things can change. I have a vague birth plan, but I'm not going in with my laminate this time. The first time around, I had heard about a birth plan and I got all panicked that I needed to have a birth plan. So my sister had a baby 7 days before me, so I was like, can I copy your birth plan? So she was like, I don't think that's how it works. And I was like, no, I'll just have a copy of your birth plan. So got her copy, laminated it, brought it in, and it had all sorts of things on it that were not me. Like, if she did gentle birth, that personally wouldn't be for me. I'm all about the epidural. They're like, okay, so you don't want an epidural? And I was like, what? No, I do want an epidural. I hadn't even read the birth plan properly. It was just that panic of, okay, I need a birth plan, so I better do this. You know, it was kind of, I'd heard of it, and then you panic and think, I must do that too. So I did the first time around. The second time, I tried to have a birth plan. I went with my consultant. I was like, can we sit down and do a birth plan? And she was like, I don't think that in your particular case you need one. So she told me to just write out my 3 points and go with it. And I don't think I even remembered to bring them to the hospital, to be honest. So this time around, I'm not going with a birth plan. I'll go with the first thing I usually say when I arrive in the hospital is, don't forget my epidural. That's just my thing. Other people go in and say, you know, I don't want an epidural, or I want this, or I want that. My thing is, I do want the epidural. So that is my main birth plan.
Lesley, I'd say to you, we talk about birth plans. Do you think that maybe, rather than sometimes if you feel that you're not able to write it all down and laminate it, I know for me, I think maybe sometimes with your first through nerves or you know, that you're kind of, you're apprehensive of what's going to happen, that maybe you lose your voice a little bit, but maybe having 3 things, exactly as Shoshannah saying, that maybe that are your 3 fears, that you can share that with your midwife. Because that would be my thing that I would say to my midwife, is that when I went in initially, I was like, I'm afraid of an instrumental birth, which I ended up having, but I had shared that fear with you. You think, so rather than maybe having, I'd like to sit in the pool, I'd like skin to skin, I'd like baby to go to breast the minute that the baby's born, or I'd like a quiet 40 minutes after baby's born in the room. Is it better to maybe just say, look, these are my 3 things that I'm feeling apprehensive about, rather than maybe setting yourself up almost?
Yeah, and we almost, as midwives, you know, if we were ever asked, where did they come from, birth plans, I don't think we'd know the answer to it. They sort of appeared. And in a way they're great, because, you know, if women come in advanced labour, they're very you know, they're not usually able to talk too much, and it's quite good to have this plan that explains, you know, they'd like the lights off, or you know, they want everything done quietly, or they want their partner to tell them what the sex is because they don't know. You think, yeah, that's great, but somewhere along the line it became almost a format that if you tell your midwife you don't want a cesarean section, you won't have one. And I think that's an easy mindset to fall into. You know, if you're pregnant for the first time and you're a little bit worried and you've been told, you know, actually, if you do all this, you won't have a cesarean section, but, you know, just put that down in your birth plan. And, you know, we almost have like a destiny of how we're going to give birth. And with your first baby, it's usually not quite as straightforward as it is with your second or your third. And, you know, to prepare women to say, you know, have a hopes and fears, certainly. But the big things that you want, if you've researched them and you know, absolutely, I want an epidural. I mean, with my first, that was my plan. I was having an epidural, and everyone knew that. And, you know, I didn't have one in the end because I didn't need one. But my birth partner knew that I wanted an epidural. My midwife knew that I wanted an epidural. But it was never this set in stone, absolutely, she must have an epidural as soon as she walks in the door. And I think sometimes with birth plans, we have midwives almost so frightened of them and not following them and complying with them that women end up with a lot of things that they've either not really examined or they perhaps, you know, if they'd had a bit more of a discussion around epidural and why they want the epidural, and was there anything else that they wanted to do beforehand, that they may actually have chosen differently. And I think sometimes it's great that we've got the birth plans because we can understand exactly what women want from their birth. I like them as well because it encourages the birth partner to be able to advocate and say, oh, well, we've discussed this and, you know, we've got a safe sentence for, you know, as soon as she says, get me an epidural now, that is, all bets are off now. She's having her epidural. And there's definitely ways in which we can make them better. But certainly when they do come in laminated, it's almost you're saying to the midwife, this is not open for any discussion anymore. This has to happen. And I think as midwives, we are placed in a situation where we don't always know the women antenatally that we're looking after in labour. And, you know, you pretty much put it down to that birth plan. So in a sense, you know, if you've got a really good birth partner that knows exactly what you want, and they can come in and say, well, actually, you know, she did say she wanted the lights off, but, you know, she'll be open to discussion, then I think that in a way works better than this really rigid birth plan.
I think you may almost need to look at it as like a pandemic. It's ever moving. You know, like your labor is it's an ever moving, and we're going to talk about that a little bit now and dive a little bit deeper into it. But especially if you're watching this and you're going into your first, you know, a lot of conversations don't happen, and a lot of things that you only really told is ask for the epidural. So it's like this, you know, those stages prior to it, really we don't seem to discuss. It's like you don't want an instrumental birth, you don't want an epidural, and, you know, you don't want a C-section, rather than actually it's a very fluid and sometimes fast moving. It can go from being nothing to very fast, very quickly, which especially when you're going in on your first can make you mute. You're so kind of just what's happening. So actually, exactly, you said, having that birth partner there to say, we discussed this, I'm just wondering what, you know, what you think or what we can do that works best here. And in saying that, over half of Irish women surveyed experience episiotomy or a tear after childbirth. And I know for me, it was something I never asked any questions about on my first. I knew absolutely nothing about until my son was born on the 24th of November. And on the 25th of November, I was sitting on a cushion crying, wondering would everything not be swollen. So I suppose that those conversations that we don't really, you know, have that often. Lesley, I suppose we'll ask you first about your experience about that, you know, going into those territories of that you can tear and episiotomies and C-sections from a perspective of a midwife. And then Emily would talk to you in terms of a pharmaceutical point of view of treating them after. But that, I think maybe we don't have those conversations, especially ahead of our first, of that tearing, episiotomies and C-sections can become quite commonplace, especially having first baby.
Yes, and I think we do women a huge disservice by almost having this silence around it, because we don't want to frighten them. And what we actually do is we have them in this mistaken belief that if they do everything that they've been told when they've done their Google searches and all their research behind childbirth, if they do all of these things, and they will have this perfect birth that they want. And certainly when I had my first, I had a forceps with my daughter, but I see it as, well, I worked hard for that. That was my birth. That's what I was destined to have. And I had an episiotomy, and, they are a struggle to recover from. And I think to have women so unprepared for the recovery aspect of an episiotomy, you end up with women that spend most of the time in recovery fearing that there is something dreadfully wrong. Whereas if they're told, this is, if you end up with an episiotomy, and it's still their choice, they still have to consent to everything. But there comes a point, I think, sometimes in intervention where we're saying, we're not doing this to meet a set criteria of episiotomies that we have to perform every month. We're doing this because clinically we know that we need to do this in order to give your baby the best chance. And, if we have those conversations with women, but then say to them, once you've had your episiotomy, this is how you look after it. This is how you feel. This may help, but they are very uncomfortable. And it's not really until day 3, day 4 that actually the discomfort hits that peak. And I think if we're honest with women in that respect, it makes it easier for them to almost accept that, yes, I'm going to keep my painkillers going because that's keeping on top of everything. But yeah, we seem to have moved away from being honest with women to being sheltering them almost because we don't want to worry them. And, they give birth, they carry a baby and they give birth. As a species, you'd say they are the stronger sex. I don't think anyone watching a woman give birth in whichever way they give birth would say that they're not strong. And I just think, why are we not being honest with them? Because we're not doing them any favors.
I know going into my first, the word stitches never crossed my mind. And the only time I talked about stitches would have been in terms of a C-section. And I remember going back to my room after having Usheen, and the midwife sorting me out and change my pad and getting me into bed. And she was like, let's have a look. And she's like, a lot of stitches there. And I was like, where is there stitches? And she was like, well, you've a lot, like, because we hadn't had those conversations. And just for women, it probably is, maybe something that, exactly as Lesley said, that we need to talk about more, that it is a very, I know natural, of course it is, you're giving birth, but, in terms of if you massage prior to going into birth, do you see that in the labour ward? Because I know for me, it was like, you should massage before you go and have a baby. And I was like, you want me to massage where and do what? And then after I had Usheen and 20 stitches later, I was like, if I had have just massaged. And do you find that, Jess, that women aren't having those conversations, or it's almost like we wouldn't even enter a conversation about that prior to having our first?
I still think it's a bit of a taboo thing. My main kind of expertise would be kind of working in the postnatal wards, and some women, you'd say, Jeannie Mackey, first baby, no chairs or a graze or something, and they'd say, oh, I did a bit of perineal massage, but like it's nearly like, oh, that's fantastic, it's because so little, talk about it. There's so little talk about it. But yeah, I do like that there definitely is a correlation between it from just kind of observing. But I do feel as women, just as a species, we are very like hush about that kind of thing. And I think it's fantastic now that with my Expert Midwife that there's a product just designated to that women realize, oh, that like there's a name on it, peri-prep, like, it's I think the fact that there's a actual product, it puts it in women's minds that, oh, should I actually be doing this? And then look into the research behind it and how it can benefit them. But I still think we're getting there, but we're definitely not fully there. It's not part and parcel of you know, someone would say that they're doing X, Y, and Z in preparation for birth, but it's still not really, I suppose, a natural part of the conversation. When
we have all these conversations about packing the bag and getting all those, but the peri-prep, and again, Lesley, the packaging, like I have to say, everything's there, and it encourages your partner, if your partner is there, to get involved in that as well, that there's that, because you can come to the point at 36 weeks pregnant where you're carrying around this big bump and you're like, where it does get you, you know, add a little bit of a connection back for the couple to try and connect back together, but also you are prepping. But again, conversation we don't naturally have, but everything is there in the packaging for you, so you can go into Emily and have this conversation. And with women, do you find in the pharmacies, you know, we can talk about you know, post obviously partum in a minute, but in terms of going in prepping for birth, would that be something they'd even, would perinatal massage even come into it? Perineum, pardon me, massage.
Yeah, I suppose, Suzanne, it's like really we find our first relationship as a community pharmacist with a woman is when they're pregnant and having their first baby. I suppose particularly postpartum, because, you know, you're tired, you're exhausted, and you just don't know what to do. You're seeing things like cradle cap and, you know, cracked nipples and things, and you just go, what is this? So the pharmacist is a great accessible protocol for professional advice on that. Pre or during pregnancy, we probably see a lot around indigestion would be probably the main thing people come in with, and that hospital bag question. So they come in and say, what should I have in my hospital bag? And I suppose for us in Mccauley's Pharmacy, we're absolutely thrilled to be stocking my Expert Midwife products. Lesley, they're absolutely fantastic. They're just brilliant products. And like you said, Suzanne, if they were available when I was having my two sons, I would have really benefited from them. But what's more is the website, I have to say, is absolutely excellent. And it's a really good resource for, you know, good professional advice that you know you can trust. And there's great information there on the hospital bag and on the perineum massage. And I think the hardest part for people is, you know, the research you've done has said over 60% of women are aware of it, but actually doing it is the step. And I think having the product just helps you get started with it. And it gets over that hurdle of, oh, what do I actually do and how do I start? And the fact that the directions are there, easy for you to get. It's absolutely a super product.
And the reality is, Jess and Lesley, is that recovering from a C-section, from an episiotomy or a tear, again, maybe we're fed this bounce back ability. And actually, I think 9 days after I had Sadie, someone sent me a message going, you know, you look like, and I put up a picture of diaphene, whatever other painkiller I had, and that I was on an antibiotic because for infection and for swelling. And like, so, you know, it isn't this bounce back ability, you know, maybe for some, but for the majority of us women, it doesn't. So recovering from episiotomies and tears and C-sections, what advice would either be give in terms of products? You know, and again, infection is always is something we probably don't talk about that often, but it is very, very important to look at the infection side of things, and then, you know, not going to the doctor in terms of being able to go to your pharmacist and having a chat about that pain. Jess or Lesley, what would you know, suggest there?
I don't know who's going to go first.
Yes, I'll throw to you first, and then Lesley will go to you.
Yeah, like I definitely think there's a narrative out there, and I think with kind of media to blame as well, that if you have your baby, you're bounced back, and again, because women don't talk about the likes of episiotomies and sutures and all that kind of stuff, you're kind of just expected to get on with it. Whereas I even know personally, I had an episiotomy on Ellie, and I remember just sitting there thinking, like, does no one know what I'm going through? Like, you know, and it's like you're sitting there trying to smile and hold your baby, and people are visiting, and you're like, I'm in so much pain. Like, no one has any idea what I'm actually going through. Whereas, and the likes of, you know, infections and that too. Again, I was like yourself, had an infection as well. And I just think that the main thing obviously is hygiene measures, but we are definitely badly designed insofar as our perineum is between two areas that have a lot of bacteria. And I do feel as though that we've been missing the likes of spritz for bits and that too, just for that clean feeling. I was talking to a lady a couple of weeks ago, and she had actually used the products and said that it's just like yourself. She wished that, you know, she had them years ago. It's just to feel clean in between, you know, obviously pad changes and showers. And I think that for even, you know, cesarean section scars too. The main thing is, you know, keeping them as clean and dry as you can, but also to be aware as well that, you know, these things can happen, that you can have swelling, you can have bruising, you can have infections, and that there's a kind of a clear pathway of what to do, rather than sitting there feeling like, is this normal? Is this not normal? Because we don't talk about it enough. So yeah, I don't know how well I answer that, but
perfect answer. Lesley, in terms of that, like the post C-section and recovery, you know, obviously you've been through labor wards, you've seen every possible outcome of every possible birth, you know, and people, again, that bounce back ability. A section is surgery. You know, you're going in, the belly's prepped you, your spinal tap has gone in. And again, then you're left exactly as Jess says, and Emily and Shoshannah, I'm sure it's sitting with the baby. Hi, I'm here. So what, in terms of our body, can women do to give ourselves the best possible chance?
Pain relief. You need to be able to be as mobile as possible, as quickly as possible. And that doesn't mean going for mad walks and things like that. This is more about just gently getting around the house, getting your abdominal muscles working, getting your gut working again, because, you know, anyone that's a trapped wind after a cesarean section, you know, it's really, really painful. And the easiest way is to avoid it. And if you've got really good pain relief on board, and you're staying on top of it, and you've got your partner or, you know, any kind of support person there saying, right, come on, you need to take your painkillers. You might not feel that you need them, but if you miss them, you will feel that effect, and it'll stop you moving about as much as you would have done. And then you've got all the compounding things after that, you know, like your trapped wind and things, constipation, all that, you know, it's just horrific. But, you know, you stay on top of your painkillers, you are a bit more mobile. You're able to sleep more as well. You're able to rest properly when you're comfortable. And, you know, it is important that first week that if you can, just limit your visitors to people that will come and bring you food, that will feed you, that will help you heal through really good nutrition and rest and pain relief and fluids. And these are the four main things, really. If you can get that, you know, you'll go a long way to recovering more quickly. That's not possible for everyone, though, you know, especially nowadays where you can't have people in your house in the way that you used to. But the big thing that we noticed as midwives back in the UK is during lockdown, when women didn't have this parade of visitors to see their baby, they actually got those babies back up to birth weight by day 5. And this was phenomenal for us. You know, it was sometimes it was 3 weeks for breastfed babies before they get back up to birth weight. And you know, a lot of it you knew was down to the fact that there were interruptions in the breastfeeding routine because of visitors. You know, women themselves would say, I'm just going to get everyone over on one day and then it's out the way. So even the language they used was, this is not really beneficial for me. I really don't want this. I feel like a bit of a wreck, if I'm honest. I don't feel makeup's going to cut it, but we'll just get everyone round. When all they want to do really is rest. And, you know, and we go back to antenatally when we're worried about how women will react to discussing forceps and episiotomies, because, you know, we worry that they're a bit delicate. But then they go through major surgery, but that's fine because, you know, they can make cups of tea for folk and do the vacuuming because there's people coming around and who else can do it. And it's, you know, we almost need to go back and say, look, not only have you had major surgery, if you've had a vaginal birth, you've gone through pretty much the same expenditure of energy as you would in a marathon. Your muscles need to recover. There's a lot of your body that needs to recover. You've probably gone without sleep for 36 hours. That again, you need to catch up on. It's rare that you would ever have surgery and compounded with all that build-up as well of lack of sleep. You know, labor takes a lot out of women. So yeah, for me, that's always the big thing. Stay on top of your pain relief. Your partner, you know, they will be as sleep deprived as well. You know, there's an argument that they need just as much looking after to remind them to eat. You know, someone needs to feed you so you can feed your baby. But, you know, they're sleep deprived too because they're up trying to support you and trying to help. So it really does need someone to say, right, we'll bring all your meals over, we'll drop them on the doorstep. And I really worry as a midwife when I used to visit postnatally in that first week if the house was tidy, because I think you're really not prioritizing properly. You need to be sleeping and not running around with the Hoover. And I suppose in the NHS or in HSE, it's harder to say that. When I worked in private practice, it was easier to say to my clients, look, please don't be doing any housework, because, you know, it's a week. What's the worst that'll happen? You know, you might
as a parent, especially for a first time, which my husband did after I had Oisin, saw in those, because obviously I'd had quite a traumatic birth, and they happen, you know. I had a full instrumental. He was essentially pulled from my body. I was tore, I was stitched, you know, it was like tick 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 all, and I just physically couldn't face people. And people mean well, they want in on the baby, you know. I suppose maybe this is what the good thing that the pandemic will lend us to, is that he at that point went, you know what, can you just give us a week let's just gather ourselves. And we just went into our own cave and just stayed together, you know, as this newly formed three. And I think that's okay. I think women probably need to know that that's okay, to say, can you just back off? We're just going to try and do our thing here, rather than lifting up said baby to the community and going, come on, one and all. And actually, speaking of which, it kind of nicely lends into that post-birth discomforts and everything that kind of comes with it. And I suppose that those unexpected issues that you were talking about there, just in terms of breastfeeding and nipples cracking, they crack, it happens, you know, it's all part and parcel. But again, we have this maybe idea of this perfect baby latched on to the nipple, and mom is so relaxed, where the reality of the hitching and minching and the lipping and getting and latching, and then you're sitting going, this is mastitis, is it not mastitis, do I need a cabbage leaf? And again, brilliantly, my expert midwife have come in on this, and that you need one hand, Lesley, oh, you know, these things are designed by women. But Shoshannah, I suppose that's another thing, that, you know, you have your two kiddos at home, baby number 3 is on the way. What were those things that you went, I was not expecting this. This was not what I signed up for, you know, I didn't see this on Instagram.
Yeah, definitely the same as you, like episiotomy and the stitches. It's not talked about, so it's such a shock to the system. I don't think that it's talked about after birth, and, you know, how you physically feel after birth is talked about enough. Definitely that. And on my first, I wish that conversation, I wish I did what you did, Suzanne, and just said, you know, we need a week. Honestly, I'd say I had 30 people over the first week that Daisy was born. Like, in the hospital, she was a day old, and my 4 best friends came in, my 2 sisters, like,
it's like a trail of people.
Yeah, I probably had 10 people into Hollis Street the first day alone, and I was so sick. I was on morphine. I was like hooked up to everything still, and I had everyone coming in. But it was I wanted to show off my baby. You know, I was so proud I had this baby, but I wasn't thinking logically of what I needed, and nobody told me that, you know, you have to recover. I wish, like Lesley, like you had just said that, I wish I had heard that, but I'd never heard that, and no one prepared. And so it would be great if people kind of had that information, especially first time moms. And although giving birth in a pandemic, I'm sure, is not going to be as joyful as normal, I'm kind of looking forward to just having no one. Like, it's just going to be me and Jim, my husband, and when we go home with the baby, it'll just be us and the kids. It will be hard for us in that my mom previously on both kids came to stay, so she would kind of take care of both of us and kind of help with the kids. So it will be sad to not have that, but at the same time, I'm looking forward to, for the first time ever, not having loads of people over to see the baby and to be handing the baby around, and yeah, not have that pressure. I felt a lot of pressure to have a lot of people over. I was the first of all my friends to have a baby, and so I don't think anyone kind of understood. I didn't understand, and definitely my friends didn't, because none of them had babies, so they didn't understand how I was feeling, or, you know, that it was a lot of pressure to say, oh, can we come see the baby now? Whereas now people have had babies, I don't think they would do that. But on top of that, now with pandemic, no one's going to say, can I come over and see the baby, because they know the answer.
Yeah.
You know?
I'm trying to push around the corner, can I drop by? Is just
like, no, you absolutely cannot.
Yeah.
That would be the response this time.
Yeah, Emily, you were saying that, which I thought was quite interesting, is that the first time you really kind of probably get to know a lot of women within your community is when they, you know, just maybe are coming towards the end of the pregnancy, maybe getting the bag ready, but especially in that post-birth when there's hemorrhoids involved. Like I genuinely remember that, having to go to the toilet for the first time, just thinking, this is it, this is game up, this is where I die, this is what's going to happen. Because I was like, I had so many stitches, I was so swollen, I had hemorrhoids, you know, all the things I didn't see in the magazines, Emily. But like that, it was to go in and have a great chat with my pharmacist, who was, in fairness, he was absolutely incredible. So what are you finding women are coming in with in terms of that, those first couple of weeks of those discomforts, and how you can help them?
Yeah, I suppose, Suzanne, it's very nearly like what Lesley said, but very much, I suppose, pain relief is really key. And I think listening to your body, trusting your body and listening to it. If you're in pain, that's your body trying to tell you something. So, you know, if it's a prolonged pain or it's longer than expected, that needs to be looked into. But we would often find very much what Lesley said about people not taking painkillers regularly. So often they'll come in and say, they just gave me paracetamol. Now, paracetamol is a fantastic painkiller, and it's very effective, and it's very, you know, safe in breastfeeding and everything. And then you say, well, are you taking them? And I say, well, I took 2 this morning, and then it was nighttime before I remembered to take any more. So, you know, it's 2 every 4 to 6 hours, and more than 8 in 24 hours. But it's important to stay on top of it, because a buildup of pain is very difficult to get rid of. It's much better to manage your pain on a day-to-day basis. And I suppose the pharmacist is very well placed to, you know, each person is individual, so you can't really say one size fits all. So they're very well placed to talk to you about what's the right thing for you. Often you might see somebody on maybe diphenol or ibuprofen as well, which is an anti-inflammatory, really tough on the stomach. So very important you're taking that after food. You have people who want to take a codeine product because they're used to it. You know, it's not a good idea, especially unless it's been recommended by the hospital, because, you know, the side effects of constipation is just not something you want on top of that. And really, you'd prefer not to use it if possible in breastfeeding. So unless it's recommended by the doctor, it shouldn't be used. And then I think, like, the products that my Expert Midwife, like, you know, you can do all the pain relief, but you can still just be in discomfort. So, you know, especially after vaginal birth, just that Spritz for Bits, I think, is absolutely phenomenal product.
It's heavenly.
Just to help, exactly. And then with the cesarean section, it's really being kind to yourself. You've had major surgery, so keeping it clean. If there's any smell or any oozing, just reacting to that immediately. And if you're unsure, because again, I find, you know, the main thing with women when they've just given birth, you're exhausted, you're not thinking straight, your hormones are all over the place, you're trying to manage breastfeeding, and then everything is new. So you're like, am I smelling something? Is that ooze? Is it not ooze? Come down. We have private consultation rooms in all the areas, and they'll signpost you in the right direction. So they'll say, actually, you know, that's fine, or you need to use this product, or, you know what, really, I think it's time for a phone call to your public health nurse, or it's time to see your GP. So they'll signpost you in the right direction for you. So that's probably what I'd say about getting to know your pharmacist.
In terms of, I suppose, breastfeeding is, you know, so many women try to breastfeed and maybe it doesn't go the right way for them. And Lesley, you and I had talked previously about this, about the no harm nipple balm, because it's there's nothing in this, so you can put it straight onto the nipple, a baby can go straight on and latch. But the thing that I had said to you was, it was done with a one-hand, exactly said a couple of minutes ago. You know, a woman is designing this because we've all been there going, hang on, trying to, you know, yeah, oh yeah, I got. Whereas this is just like, whoop, dump, we're good. Like, things like that are so essential for women to know. And Jess, I'm sure you see this in the hospital all the time as well, is that this ideal of this perfect latch, this perfect, you know, yes, those moments come, but nipples will crack, and you do need to give yourself the best opportunities.
Yeah, definitely. I think, like, absolutely, there's so much information that women have, and it's correct. It shouldn't hurt for a prolonged period of time. But I feel as though a lot of, especially kind of first time moms again, come in and they expect it to be completely painless. And you're saying, you know, but that skin has never ever had that demand on it before. You know, it's like the skin on your lips. If you're constantly sucking on the skin of your lips, you're going to irritate it. It's going to become sore. And that's exactly what's the same with the nipples, you know. So you are going to be in discomfort. And it's just to recognize that, yeah, the initial latch, you know, countdown from, you know, 60 seconds, it shouldn't last any longer than that. But I think, you know, it's just to, again, get the information out that, yeah, the first couple of weeks, it is going to be a bit painful. You are going to be tender. And then again, just to know that there is, you know, there's things that you can try, you know, to alleviate your symptoms. But I do feel as though a lot of women come and say, no, didn't read this in the book. It's supposed to be absolutely painless. And you're like, yeah, that's what the book says, but that's not the reality. And I think we're doing such a disservice for women to, you know, completely, you know, keep saying that over and over again. And then the moment that a normal thing happens, that they're a bit tender, that it's like, oh no, hold up, this isn't what I was expecting. I don't want to. And then again, you know, it's unfortunate that women say, no, this really wasn't what I was expecting, and I actually don't want to do it. Whereas I think if we have gotten the reality and, you know, a realistic approach with the information that we give, to say that, yeah, you will actually be quite, you know, it will be uncomfortable for the first couple of weeks, that at least they've kind of gotten over that, you know, in their head, rather than sitting in the hospital bed and for the first time ever they've associated pain with breastfeeding. You know, it's
that association. And again, why my expert midwife, I mean, obviously we're talking about the products, but this is more than products. This is a safe space for women to go and you know, educate themselves. And I mean that in the best possible way, that if you don't feel that you're able to express it, like Shoshannah was saying, she was the first out of her pals. So, you know, there was no one to go, yeah, that's okay. Whereas this is, this is the information that you need. It's in a very safe and well-educated environment that's not going to lead you down, that you're somewhere on Google, and there's some woman in Arizona telling you that you're going to die. Like, I'm not saying that's from personal experience, but it was 4 o'clock in the morning and I didn't know where else to turn. So it's good to have a space, a good safe place to go. Talking about post-birth and Shoshannah, I'm kind of interested to see in terms of what you're thinking in the weeks to come. But according to the research conducted by my expert midwife, 36% of Irish mothers, which just irks me because I know I'm in this, said that it took 6 weeks to feel physically back, whereas 28% up to 3 months. 12% of Irish women said that they didn't feel back to good physical health, maybe until 6 months after the birth. And even in that, I think there's an element of the Irish mammy going, I'm grand. I'm actually grand. I'm actually having the time of my life. So Shoshannah, you have 2 at home and you're facing into the 3rd. So knowledge is power with this, right? So you know what it's been like. So what are your thoughts coming into that, and what do you think of that research as well? That, you know, we're bouncing back after 6 weeks, Shoshannah.
I know, like it's hard to see on, you know, on social media, which pregnant people do a lot. It's you know, you're kind of glued to your phone a lot, and it's hard to see a lot of people do bounce back. And I'm not one of those people. I just don't bounce back. And definitely after my first, it was a bad birth and it was traumatic, and I was very sick and in and out of hospital a lot after it, and I didn't bounce back, and I really thought that I had done something wrong, but I hadn't done anything wrong. It was just, as you say, Lesley, it was my birth destiny, and that's just what it was. And now, in saying that, then the second time when I was having Luca, I had this crazed panic in my mind that, you know, my first birth went this way, so my second birth will go this way, and I'm going to have a really long recovery, and I'm not going to ever bounce back. And, you know, you see these people with their gorgeous outfits leaving the hospital, and I'm like leaving the hospital in my pajamas with like my coat over, like looking around, making sure no one's going to see me. Like, whereas now on my 3rd, I'm like, I don't care. I'm leaving the hospital in my pajamas with my hair up and no makeup on, and I just don't care, because I know what really matters is me and how I feel, and I don't need to bounce back, because that's not reality and that's not normal. And I think often the look of the bounce back and, you know, the straight away having a gorgeous picture up of, you know, looking amazing, and like, that's just not me. And that's realistically definitely from that research, it's not most people. You know, most people don't feel like that, and that's fine. And I think that we should just all be a bit more honest about that. And I don't want to
you need to embrace it. I know for me, exactly as I said a little earlier on, in terms of Usheen, there wasn't even a ping. I didn't slightly, but there was nothing. I really, really struggled. I always felt that I didn't have the baby blues, but I wasn't postnatally depressed. I had what I call the baby navies. And again, as Shoshannah had said, I had my birth had been, not what I don't even know what I thought, but everything that possibly could have happened. He was very bruised and he was quite traumatized, and I was traumatized. And I remember coming home from the hospital and Joey being beside me, and I was like, we've made a terrible mistake. Like, I don't know what we're going to do here, because I physically can't hold him. I can't move. I need you to mind me, but you need to mind. So this whole big, beautiful picture, I then felt that exactly as Shoshannah said, I felt like I was the worst failure, because I didn't live to this picture I had been, sold, that I was going to sit in this blissful bubble with my baby and I'd be, great. With this, my third, with Sadie being born 16 weeks ago, she afforded me that birth, that I had the knowledge that it didn't go the way I didn't have a preconceived notion. I went with the flow. She arrived into the world. I got it. I took the time. I enjoyed her. I didn't rush myself. The pandemic will afford you that. But at 12 weeks, I had felt that I'd held my breath solidly for a full year. I'd come off the back of a miscarriage, got pregnant in a pandemic, had literally just want to keep her safe, just want to keep her safe, just want to keep her safe, just want to keep her safe. She's birthed. When she was born, both my husband and I released that energy and that emotion of just relief. She was safe. And then 12 weeks after she was born, I walked downstairs and went to Joey, I'm going to pass out, because I had just literally, everything had kind of unfolded. My body had decided it needed a break. My brain was mentally fried. So those are the narratives and the conversations that we don't ever have, because I think the preconceived, perfection of birth really is a really negative narrative for women. And Jess, do you find that within the maternity hospitals that women again feel that they have to live up to this mantle?
I feel as though there's just an ideal there, from again what we see and what we're told is supposed to happen. And I feel as though sometimes, you kind of, even on paper, the kind of what we would see as, oh yeah, that's an okay kind of birth. For another woman, that feels as though that was the most traumatic thing that could ever have happened to them. And you're kind of trying to explain, and go through things with them. But it's because they've just only heard the ideal, and that's all that they've had in their head. That's not their fault. That's what we as a society have for generations told women. And like you say yourself, it's kind of afterwards, when you kind of have a preconceived notion about how things are going to go, you kind of have to just go afterwards, and then hope that you have that support system around you to debrief and go through things with you, to realize that, this does happen for so many, yet it's not spoken about. So I don't.
That's perfect. Lesley, I suppose taking that into consideration, and as we said a little bit earlier on, there's so many different, every woman, I always think that, there's probably, do you share your birth story? Do you not? Because every woman has to go through their own labor and their own birth, and we all carry our own stories as we go along. But the ultimate is the most amazing moment. You've put this strenuous effort in, you have gone through it, and then, baby is born into this world, and it is the most amazing moment. And a little bit of you just becomes like clicked into that of going, I'm a mom. This is it now. So for new mums, well-being, those conversations about their well-being seem to take a massive backseat. And your research has shown that as well, that 3/4 of women didn't really think about the after of their well-being and how they will be, that they don't you know, take time for themselves to have that sleep. So I suppose from your expert opinion and from what you were seeing, like what can women do on a daily basis to try and assist themselves in their well-being?
So the biggest thing is talking about your birth, especially if it's not gone the way that you were expecting it to or it had planned to do. And there are some great charities that will let you offload. You know, I believe that women should be able to talk about their birth as brutally honestly as it was for them. It validates how they feel. It allows other women to feel that same validation as well. Because, you know, if you think about all those women, you know, on a labour ward or in a postnatal ward or just new at home, thinking, I've not got a connection with my baby because I'm so exhausted, you know, and I'm in so much discomfort, but I daren't tell anyone because that's not normal. Because if it was normal, everyone would talk about that. And I think if we can do that for women, actually say, you know, I mean, my labour was fine. It was my birth that just, you know, didn't go the way I was expecting it to. But postnatally, it all came all at the same time, you know, and I didn't have postnatal depression, but I definitely had baby navies because I was not expecting that crash. Just wasn't expecting it. Wasn't expecting it, and the exhaustion and the pain that I was in. And I didn't feel that I could go on a Facebook chat and be open and honest about my birth. I spoke it into like a dictaphone that I had at the time. I spoke about my birth and I've never listened to it since because I don't know how raw it actually was. I know I wouldn't have held anything back. And yes, you know, it's a shame that even though that's our births, we don't feel that we can worry other women about it. That would almost be selfish to do that. But I think in a way, by not talking about it, by not being honest, we're not actually giving women that ability to say, right, well, I feel like crap. Therefore, but that's fine because most other women do as well. Instead of, where is this immediate love that I'm supposed to feel for my baby, you know? And it's the majority of women nowadays won't feel that way, and that's absolutely fine. That comes once you've recovered and actually prioritized yourself. If you're not looking after yourself, you cannot look after a baby. You've got to look after yourself and you've got to prioritize you over your baby. But there's a huge guilt that comes with that. As women, we are seen as, no, you can't do that. It's got to all be about your baby. Otherwise, you're not a good mum. And I don't know where we came up with that. You know, I don't know.
The big stick we've decided to beat ourselves with after going through that. And funny, people may or may not recognize if like me, you avidly watched One Born Every Minute. But One Born Every Minute actually brought a conversation into my home that I hadn't expected. So again, as I said, Oisin's birth was very traumatic, but I hadn't discussed it. I hadn't said it out loud. And watching One Born Every Minute, one night, my husband was really upset, and we were watching quite a traumatic birth that was playing out in front of us. And he was like, Suzanne, that was like Oisin's birth. And I was like, yeah. And we got to sit, and he got to, because it had, as much as I was internalizing, it had never occurred to me that he was a bystander watching his wife being pulled down a bed, legs going in stirrup, and 12 people filing into a room, and you know everything that went around those couple of moments. So it's like we won't. My mom once said to me, she was like, you know, nobody knocks at the door with a badge. Nobody comes to your door and goes, well done, you didn't have an epidural. You have 27 stitches from front to back. You are afraid to poo for the next 3 months because of the pain, but you still don't get a badge. It just doesn't come, but we almost feel we should internalize all those things than saying it out loud. And Shoshannah, you've obviously been through it with Daisy and you've been through it with Luca. Did you prioritize knowing what you knew after Daisy, after Luca, or did you still kind of get caught up in it, or do you feel going into baby number 3 that knowledge is definitely power this time?
I definitely feel knowledge is power this time, but I think going in to have Luca, I also felt that as well. Like I knew a lot more, and I was a lot more sure of myself. when I had Daisy, I wasn't. I was kind of everything had to be perfect, complete perfectionist. Like everything has to go this way. Whereas when I went in to have Luke, I was like, that's not going to happen, and that's fine. And you know, I was more honest with everyone about the birth, and you know, like that. Previously, I would have kind of kept it a bit more quiet what happened when I had Daisy, and been like, I'm fine, everything's absolutely rosy and grand. Whereas the second time, I remember the day after, I went on and I had kind of not filmed but I had done stories, Instagram stories throughout the labour and throughout the birth, and a lot of people were very positive about that. Now, I didn't do the delivery bit, wasn't that great, but a lot of people were very positive. So then afterwards, I went through the birth story, and I was probably, some people would say too honest, but just told it as it is, because his birth was very a normal birth. Well, what I would think is a normal birth. It was, you know, it wasn't that. It was, every birth is a little bit traumatic, but it wasn't that traumatic. But went through everything in detail, and I'd say 99% of people were, that's great, and you know, I'm having a baby soon, and that's really helpful, and that's good to know. Whereas there is still some criticism out there, you know, people still sending those messages. You shouldn't be saying that. You shouldn't be telling people that. But why should I not be telling people that? Because that's what happens. That's normal. Like, why is there a pressure to be secretive and be perfect? And why can we not just be honest? But then when I looked at it as an overall, you know, it's always a smaller percentage of people that are going to be negative about things and say, keep those things quiet. And, you know, maybe they're not even women. Maybe they're men using women's profiles, because surely women want to know. Women want to know what's going to happen, you know. It's good to know.
We all kind of, I think Emily, you probably find the same, and Jess, maybe you find the same. Lesley, maybe you might have knowledge of being, you know, within midwifery, but I think that we weren't told. So again, it leads to, you know, narratives that flow from your body has let you down, that this is not the ideal that you thought it was going to be, that you're stitched or you're sectioned, or all of these things. Where I think if someone had said to me, you know, again, as we said a little earlier on, it was like epidural, C-section, poo on a table. They were, whereas it's like, actually, yes, you may tear, yes, you may be cut, yes, it may be a section, but our overall goal at the end of this day is that baby comes into this world safely. And from there, it's not all encompassing about that baby. Your body and your well-being is so important. And actually, to tie into that, another question, which I'm sure we've all been asked, which I get asked every single day for the past 16 weeks, is the baby sleeping? Is the baby sleeping? Are you sleeping?
The worst question.
Are you sleeping when the baby's sleeping? I'm like, did you tell my 4 and 6-year-old that I'm supposed to be sleeping when the baby's sleeping? But sleep deprivation will drive, if you are in a relationship, if you even if you adore your other half, you will still want to smash them in the face. But and if you can take, which I've only learned on my third, that myself and my husband had a conversation of the dishwasher foaming at the mouth, that we both went, we're very tired. We are very tired. So Emily, in terms of sleep deprivation, I know on my first, I never would have thought to go to my pharmacist, but you guys are there and the support is there, right?
Yeah, of course, Suzanne. And I suppose, like, you know, there's highs and lows after having a baby, and like you said, there's extremes of that, from the baby navies, which is my first time hearing that expression,
I made it up.
Full-on postnatal depression. So yes, of course, you come to your pharmacist and they'll give you advice on what's the right thing, or if you're worried about a partner or maybe a daughter or something and you just want to get advice on what's the best way to handle this. But I suppose sleep is vital. And I thought what was really fascinating on that, and the research that my expert midwife did, is that on average, new parents are only getting just over 4 hours sleep. And if you say that when you're not in the midst of that, it's like, how could you function with just 4 hours sleep? So, you know, it is incredible what you're doing. And I think that probably my advice is what everybody says, but it's much easier to say it than do it. And you've just said it there, but it is sleep when your baby's sleeping. And I mean that in that, like, my second was a bruiser. He was breastfeeding every 2 hours, but there's always a window that they just have that little bit longer sleep. Now he was sleeping a bit longer, it was a really bad time in the house. It was 6 to 9 or 6 to 10. But if I didn't get a sleep at that point, there was, you know, that little bit longer sleep, there was no chance I was going to get through the night. So try and work it around that. The other thing I'd say is try and take a nap if you can, when the baby's not in the same room as you. So either if somebody's bringing them out for a walk, or you can get into another room, but just instinctively our bodies, every little twitch or noise they make, you just jump at them. So it's very difficult to fall into that deeper sleep, and we need that deep sleep for recovery and for well-being. And then I suppose it's creating the environment for sleep. Leave the phone. The phone is blue light, it's stimulating. Just put it outside the room and you will lose hours scrolling away at whatever, and you could be sleeping. So just get rid of the phone.
Lesley, in terms of, I suppose that's the sleep deprivation, and sometimes it's very difficult to find that level of, you know, is this the baby blues? Is this postnatal depression? Am I just on that hormonal, you know, as I call it, that hormonal roller coaster of your body trying to level out, and you trying to figure out, is this mentally that you're struggling? Is this emotionally that you're struggling? Or are you physically struggling? So from a midwife background and that point of view, is like, what should people expect in terms of baby blues? And what would you say, maybe we've gone a little bit over on the other side here, and maybe we need to have a little chat maybe with your partner, and then in turn have a chat with the GP?
So the baby blues, really just it's hormone crash. So your female hormones that you've been producing all the way through pregnancy in quite high doses aren't needed. And, you know, within that first 24 hours, they're pretty much back down to pre-pregnancy state. So it's that gives you that sort of hormone crash where you just feel a bit overwhelmed, really quite tearful. It shouldn't be lasting any longer than 3 weeks though. And really, if you're starting to feel that sort of down, depressed, hopeless feeling, or some women would call it like a black cloud, the inability to just get out of bed, not through exhaustion, but just feeling, what is the point? You know, that is no longer really something that will go on its own. That is something that you can speak to your partner about that. You can speak to any of your healthcare professionals, you know, your public health nurse, your midwife, your pharmacist, your GP. And sometimes it's as simple as saying, I'm just not okay. And it's not about not coping. This is, you know, it's a chemical imbalance that's going on now. And it's really, really important that you feel that ability to say, I'm just not okay. Everyone else that you've contacted or spoken to about will help you get that sorted. That's all you need to say is, I'm not okay. You don't have to physically do anything else. You don't even really have to physically pick up the phone. But it's another reason why it's so important that in pregnancy, we are having these conversations with the partners, you know, so that they understand that if your partner is saying to you, I'm not okay, please don't say, oh, you're fine, you just need to sleep, or you'll be fine next week, you know, or let me get you mum, that sort of thing. It's seriously to say, right, well, I'm going to phone your midwife, or I'm going to nip to the pharmacy, or I'm just going to phone the GP and get you an appointment. It's that, because the worst thing that will happen is she'll say, I'm fine, I just needed to sleep, you know. But it takes a lot of courage for women to say, I am not okay. And we have to listen. We have to listen.
And the support is there. You know, I think, and I'd love to know what your guys' experiences, and Jess, actually as a midwife, I would love to get your experience of that. But I know for me, I kind of felt that it was a solo journey, and it was only one of my pals rang me. And I said to her, I can't stop crying. I don't understand. And I was like, is this going to stop? And she went, I don't know. But if it doesn't, we'll get it sorted. And it did. And I spoke about it. And that's why I said it was baby navies, because to me, it was just that I would have this hormonal drop, or I would be postnatally depressed. But I was definitely somewhere in the middle. And I suppose for Jess, for you, your daughter is 4. You have the knowledge of being a midwife, and then you've gone through, so you have all of this information at your fingertips. How did you find it?
Yeah, so I had the baby navies and I had postnatal depression, but I feel as though I think kind of going back to what Lesley was discussing there, like I think it's definitely normal for the first 3 weeks to feel overwhelmed, to feel an immense sense of responsibility, to feel scared, you know, all those emotions are totally normal. But like yourself, it's kind of, I kind of went 6 months feeling I was baby navies until it actually clicked. No, it's postnatal depression. It goes past the point of, you know, just kind of being tearful. It's a full day thing of just trying to not cry, just going through the motions, not being in the moment, and then constantly trying to just push yourself to do things. Like I would have to, like, again, you know, getting up in the morning, like knowing that you can physically get up in the morning, but just not seeing the point of getting up in the morning, those kinds of things. But from a midwife perspective, I feel as though it probably took me so long to admit that I was not okay, because I felt as though I should have known it all, and just expected to you know, to be able to kind of talk myself through it, I suppose. And yeah, I think and again, trying to just kind of brush it off. It's grand, I need to sleep, I'm just tired, you know, or I need a cup of coffee, and brushing it off for months and months. And like you're saying as well, like Lesley saying, oh, I'll just go get your mom. I don't know how many times Ben came in from work and I'd be like crying in the hall, and he'd be like, I'm just going to call your mom, you know, because it's hard to say I'm actually just not okay. Yeah, I'm not okay. And again, it's one of those things I think that we need to talk about more. That yeah, it's okay for the first 3 weeks to feel as though you're totally overwhelmed, but when you feel as though it's hard for you to get out of the bed, you don't see the point in even eating or you know, looking after yourself, you know, and that everything feels like a momentous task to do. Like that's definitely, you know, it goes deeper than baby navies. Yeah.
And just when you went and got, like, and thank you so much, by the way, because I know that, like, we're pretty kind of glitched as women to not say it out loud, and especially to share with someone like that. So I really appreciate it, and you will help more people than you realize just in saying that. But once you did, you know, decide or make that jump and that leap of faith and go, I need a little bit of support here, how did that play out then?
Oh my God. I walked into the GP. I said to Ben, look, again, after a lot of to and fro, I eventually did say, I am not okay. Booked the GP appointment, and he had stayed out in the car with Ellie and went for the walk. And I remember I just went into the GP, and I'd say for a good 5-6 minutes at the very start of the consultation, I couldn't even get the words out. I literally was just snotting and crying and saying, I don't know what's wrong with me. Like, she's 6 months old. I should be okay by now. Like, she's not even a newborn. And the GP kind of had a little chat with me, and then also gave me I'm sure you all filled it out after you had your babies, the Edinburgh postnatal scale, you know. And I think sometimes giving that to women straight after having a baby, like in the postnatal ward, it's not accurate. I definitely feel as though something we should do later on, but anyway, that's another story. But I remember filling it out thinking, if I hand this back to her, she's not going to allow me to go out, you know, and take care of my baby, because I knew, like, what I was feeling, to be honest, was just, on paper, it looked really, really bad. And yeah, it scored crazy high. And, you know, there and then she was able to link me in with support systems. I put on medication. But I remember walking out, like, panda eyes, just feeling like, oh, like you had said, you know, Suzanne, that kind of just release. But like, it should, like, not that it shouldn't have taken me 6 months, but it's I look back now and I feel sorry for that, for me, you know, that it took 6 months to admit that I'm actually not okay. And I wish women felt more supported to say that they're not okay. You know, we don't need to hide it and feel as though we need to shrug it off and say, no, it's just, I'm tired. You know, I'm tired kind of covers all bases, doesn't it? Like, if you're cranky or if you're emotional or if you're a bit snappy, I'm tired. It's just a blanket term. You're not tired. You're not okay. That's what's wrong.
And this is why having a place like my Expert Midwife, yes, we have all the products that can keep our nipples hydrated and not cracked to pieces, that are bits spritzed and everything in between. But having that place where women like you, Jess, have those conversations and say it out loud, they make all the difference. Talking about that our vaginas will tear, they may be stitched, we may be cut for a section, our nipples may crack, you know, our well-being is really important. They're really integral parts. They're way more important than that bag you're packing to bring into that hospital, you know, and that you bring home and sits in the corner of the room when you come home. Those conversations and sharing that type of honest, pure honesty Jess, that makes all the difference to women, definitely. Before we finish up, I would like to ask you, because the landscape is very different now, and Shoshannah, you're going to have a baby like I did in a pandemic where, you know, things are very, very different. But as mothers, I would love each of you to tell me something that you feel that every mother should know in terms of well-being for herself. So I'll give you all the Expert Midwife products, because they're there and they're there to support you. So go and have a chat with your pharmacist, have them in the kit and ready to go, have the bag packed and have all of those things. But in terms of your well-being, Emily, what would you say, you know, as a mother? You have your pharmacist, you can take the pharmacist hat off for a second.
Yeah, Suzanne, I think be kind to yourself. I think that really is key. You know, what you've done is just miraculous, and from the full 40 weeks of holding the baby is incredible. And then just be kind to yourself. Yeah, if the house is upside down, so what? If you want to lie down, lie down. If you want to watch some crappy Netflix, do it. But look after yourself. And I think Lesley said it, if you don't look after yourself, you can't look after your baby. And you know, everything feels better when you look after yourself.
Absolutely. Lesley, you've brought an incredible, I said it at the very start, I wish you had have been in my life 6.5 years ago, but thank you for coming into my life with my Expert Midwife products 16 weeks ago, because we've become firm friends, your products and I. But irrelevant of being the woman that has brought this product and being a midwife, as a mom, what would you say to other mothers?
Be kind to yourself, but take time for yourself. Have that bath, you know, have that 20 minutes in a bath every day if that's what you want to do. And if you want to have time away from your baby for 10 minutes, 15 minutes every day, longer, do it. There's nothing to feel guilty about, nothing at all.
Absolutely. Jess, you're a midwife. You can, I suppose, more than ever, you're seeing across our maternity hospitals women facing into the uncharted waters that are, you know, the pandemic, the ever-changing visitor regulate, everything that goes with that. You see all of those things. But again, as I say, taking that hat off and everything that you shared was, what would you say to the mums that are coming into you?
Yeah, to echo exactly what the other ladies have said is, you know, be kind to yourself, be gentle with yourself. And the mom guilt, again, like Lesley said, it's okay if you want to have that time to yourself, like 10, 15 minutes a day without your baby, and remember who you are. You know, we were all a person before we become moms, and just to remember that girl, don't lose her. And just to keep talking, you know. I think anything, once it's built up to a point, it can explode. So I think on a daily basis, check it in with yourself, check it in with whoever it is that you know is your main support system, and just be honest, even if you feel as though, you know, you're the worst in the world for thinking what you're thinking. You know, when you say it, there's always going to be someone that will say, yeah, I felt that too, or yeah, that's totally normal. So I think, yeah, be kind and gentle with yourself and keep talking.
Shoshannah, I'm so excited to watch this third little person come into your family, and I'm so glad that you share those moments via your Instagram and through your socials as well, because I think women definitely need that really refreshing parent and that mother in their life that they can look to without it having, you know, that Instagram-esque about it. So I know we've said it a few times that knowledge is power, but if I was coming to your Instagram page today and I'm saying, Shoshannah, I'm, you know, same as you, I'm 30 odd weeks pregnant and I'm due a baby, what are you saying to those moms?
Just take help, definitely, and when you need, like, rely on experts is definitely something I learned the second time around, and I am already planning for the third. The first time I wouldn't so much as let someone give my baby a bottle. Like, I wouldn't let someone hold a baby for very long. I would rather sit up all night just holding her, just to be in control and to kind of have everything be perfect, and that I was the perfect mother and I could do this. Whereas you're not a perfect mother by being in control like that. That's not good for you. That's not good for anyone. So I think definitely the second time around, every problem I hit, I straight away knew I needed help, and I just went and got the help. Like, we had terrible trouble with sleep. We hired a sleep expert. We had terrible trouble with the terrible twos with Daisy, and we got a behavioral expert to help us and just give advice. Just did one session to get advice. You know, how do I do this? Because you're a mother and you're meant to just know all these things. Whereas the second time and now the third time, you realize like there's no way you can just know all these things. Somebody has to teach. So definitely my biggest advice would be get expert help from the people that know. Don't just assume that you're going to know, and don't just rely on Google, because Google will give you 85 different answers and confuse you even more. So yeah, just let people help and get expert help where needed. This time I'm even planning, like, I'm getting a cleaner to come, like, well, hopefully going to get a cleaner to come and help, because I'll need that help for the first 6 weeks. And I'm gonna get, you know, you can book in these places that will bring your meals. I'm gonna organize people to come and help with meals and have things ready for the kids, because I know I won't be able to do that, and I've accepted that this time, that you can't do everything. It's not possible. Anyone who says it is lying. It's not possible to do everything, and so I'm not going to attempt it this time.
Being honest with yourself, that definitely helps. And I suppose one of the main things that stood out to me about my Expert Midwife and the products was that the products were designed to tackle taboos, like we've done today. We've done that around pregnancy and around childbirth, and you know, about those new babies arriving into our world. So Lesley, as a mom, thank you very much, because with the products, in every single one of the products, they are designed with love for women to give us the very best care that we should have when we are most vulnerable. And then the actual Expert Midwife as a support network also gives that. It gives women honesty. And I think, you know, especially from the conversation we've had today, we definitely need it more than ever. So thank you for that. Thank you for chatting with us today. Emily, thank you for bringing your pharmaceutical and your parenting hat today. Jess, the same for you, for sharing so much. I know how much those words will help women. And I really appreciate that. And Shoshannah as well, for giving us that lens of a parent and a pregnant woman in a pandemic. I really appreciate it. So thank you very much for a gorgeous chat.